Most ICU doctors and nurses are not happy with the situation of excess care for many of the patients in the units and intensive care units, because they don't believe that they really should be getting that care, and some of it they believe is unethical. So what should we...
Yeah, it's just too much care. I mean, you've got somebody there and it's like the doctors are saying we've got to fight to save this person no matter what, because we're doctors and we take care of people and that's what we do. But, I mean, you have to have some limits here of what makes sense. You can't just, particularly if there's an advance directive that says don't do that, it still gets out of hand. And it's not like it happens all the time, but it happens often enough, because that's, ICUs are prepared to give as much care as you want.
I was just talking to somebody recently who told me that his father was 89 years old, and he had, signed this health directive and done a living will and so forth, saying he didn't want extraordinary means. And he was full of cancer.
Yeah.
And they had him in ICU. He said they had tubes in every orifice, and he was supposed to be his health advocate, and he just was kind of like overwhelmed with what to do, because they were doing all these things which were against his father's wishes. And luckily his wife was an RN, and she went to the nurses and she said, can we please just stop this?
Yeah.
Let's just make him comfortable, give him morphine, and let's just let him go, you know?
Well, there's a, what, you have to know when to say when. I mean, doctors are not God. Doctors are people who are helping their patients and helping their families and trying to do what the best thing is considering what the situation is, and paying lots of respect to what they want. What happens is doctors sometimes fear death themselves so much and think they're supposed to do everything that's conceivably possible, that money's no object. That's not right. Other doctors have a fear of legal repercussions. What happens if you don't do the right things and all the things that you're supposed to do? So you might get into trouble for that.
But if the patient signed the health directive and the living will...
That's right. Well, you can there are always situations that push that edge where you're not quite sure how far do I go. And what about what the family wants? I mean, the family should be taken into account. I mean, do we need better communication?
Yes.
Obviously we do. And how far do we go with that? Who should decide how much care is ethical and how much is not, whether there's an advance directive or not? We shouldn't just be spending all kinds of dollars or inappropriately trying to keep people alive when they're going to die or have lots of disabilities if we manage to resuscitate them.
That's why it's important for families to plan ahead and to talk about these issues ahead of time, because sometimes the patient is dying, it's an elderly parent or something, and they're fighting about it at their bedside, and they really need to have planned this ahead of time, and there's plenty of help out there for people to plan ahead of time.
Oh, for
there
sure.
are geriatric care managers and, plenty of resources for aging parents.
Well, so then when you're right at the bedside, okay, and there is a decision that has to be made, do we continue the support systems that we're doing? Who do you want there? If I was there, I was the patient, what I would want is I would want you there. I would like my children to be there. I would like to have somebody who's looking at the amount of money that's being spent there, some bean counter that's looking at things. I would like to have my doctor there, and I would have to have some kind of spiritual support, maybe a minister of some kind that I would like there. And that team would be the team I would like to make the final decisions about what to do. And it's not just any one of those, it's the whole thing put together. Now, if I had an advance directive that said don't do this, that, or the other, I would want you to respect that. And I think that's what most people would want too. So,
well, too, we spend a lot of money in our healthcare system on end-of-life care. In fact, we talked about this on another show. I think there was a study about that. Yeah.
And that gets, so where are you going to spend the money? Are you going to do it on some person who's lived a full life, that's elderly, that's got end-stage disease, and do everything you can to resuscitate that person, maybe for a short period of time? Or are you going to spend that on the beginning of life? Or maybe you could spend the money more wisely to save children or to set new policies into action.
And many of the doctors and nurses are even, they're attributing this to their burnout,
Well, it can lead to burnout.
Yeah.
You wind up doing things that you don't think are right. It's a strain because it gets you right in your soul. And if you don't feel comfortable about what you're doing, you can't practice that way. I know I can't. I'm not going to be doing things that I don't think are right to do. I'll probably just find something different to be involved with when it comes to healthcare.
Yeah.
So when we're looking at how much care to give, what's appropriate, I think the team approach is a good one. Advanced directives are really important. And if we do all that and we take into account what all the aspects of what care are about and consider the money as well, we may come up with answers that are a little bit different, and I think doctors and nurses in the ICU aren't going to be so upset.